For joining us for Healthline 3, I'm Wendy Redman. As we get older, age spots, well, they start to appear, but there are ways you can make them go away. Here to tell us a lot more about some of the treatments out there, Dr. Bridges with Bridges to Beauty. He's going to be answering all of your questions for the next half hour. We want to encourage you to ask all of the questions on your mind. If you're online, just fill out the information on the screen and submit it. Really easy. Or you can always give us a call. That number is 318-219-4569. We're going to be taking all of your questions until 12:30. So first of all, doctor, what are age spots exactly?
Well, age spots is one of those features that come over time, mainly due to sun exposure and just the fact that our skin gets older. But what they are is we have certain cells in our skin that give us pigment, give us a tan, things along the lines. And as time goes on and things, those cells get a little bit haywire, okay, and they can happen in specific areas, mainly sun exposed, back of hands, face, occasionally on the top of the back, but they'll make people look older than their probably stated age.
But you don't have to keep them around. That's the good news, right? There are treatments out there.
There are treatments for them, and like I say, in my practice, I like to use something to kind of get them under control, like a hydroquinone cream, which is a bleaching agent, for about 6 weeks, and then we'll treat them with a laser and maybe even what's called intense pulse light. You don't want to take them out 100% because it leaves a white spot versus a dark spot.
So then you're just trading spots for spots
yes,
on
you're
that
trying
one.
to blend in the colors.
I get you. Okay. Well, we do have a caller on the line. Gadsden, what's your question?
Yes, okay. In African Americans, for age spots, we have light spots. So how do you counteract that?
Difficult. Now, like I say, it's about blending in things, and the white spots. I mean, if they're real white, then you can tattoo them or cover it with makeup and things. If they're just a little bit lighter, you can do a little bit of shading in by using a little bit of laser to kind of get the dark edges down. In other words, if they're white and they're real distinct, if you basically make the colors around them a little bit tanner, then they tend to look better. But it is a difficult problem. There is a laser out there that does what's called UV treatment. It's kind of like you'll localize it, and just like being in the sun and things, they'll use that spot right on that white spot, and over time it tends to get better. We're just trying to induce the little melanocytes, which make dark granules that give us freckles, skin tones, and all, to put out more of those dark granules, because that's what gives us uniform skin colors.
Okay. Does that answer your question a little bit?
Yes, a little bit.
Yeah, a little bit. Well, maybe is there anything that you can try that might help that she could get at the store, or?
Not for white spots.
No.
For dark spots and stuff, there are things over the counter. They aren't very strong, okay, and you have to use them for a long time if you are to see any results at all.
So really, you just need to see a doctor on this one.
Okay, I think I just have to deal with it with age then.
Well, makeup goes a long ways, girl.
Trust me, that's what we do in the TV business. You just kick it all on.
Yep. Okay, well, thank you.
Well, thank you very much.
Thank you for your call. If you have a question for Dr. Bridges, he'd love to answer it for you. The number is 219-4569, or you can just ask us online at KTBS.com. So at what age do people start to normally see sunspots? Or I guess they're sometimes called sunspots too. Age spots.
Sunspots, liver spots, right. I don't know where the liver spots come from, but they've been called that before. Typically in the late 40s, 50s, and into the 60s. Now, some people can get them earlier. Typically smokers tend to get them earlier than most people.
Really?
Yeah, I think it's because smoke, nicotine decreases the quality of the oxygenation of the skin, and they'll get more pigmentation changes earlier than the normal population.
Really? Do a lot of people come in and seek treatment for this?
Yes. Yeah, I think the ones I see are primarily hands and face.
Is that because that's where they're more common, or is that just where people care about removing them more?
Care about removing them.
Okay. I always thought it might have something to do with the skin, because I know it's a little different on different parts of our body.
Yeah, the problem with skin over time on the hands is it gets thinner, and for some reason the age spots tend to stand out more. On the face, it's really not a thinness issue with the skin of the face and stuff. It's sun exposed areas that are probably more commonly prone to those areas to getting the age spots.
So obviously staying out of the sun might help prevent you from getting some or getting them as bad, but anything else you can do? Right. I mean, we live in Louisiana. We've got beautiful weather here. People want to go outside.
Right. And even if they go outside and things and they're covered up and things, their hands and their face aren't.
Right. Anything else? No? Just that's really it?
Yeah. I mean, that's the main thing as far as like,
or stop smoking, I guess.
Smoking tends to kind of accelerate the process for some reason.
Okay. We were talking about a little bit earlier about how age spots might sometimes look kind of like cancer, skin cancer.
Right.
How do you know when it's an age spot? How do you know when it might need to be checked out?
Well, typically cancer, the melanomas, which is really the one you want to jump on fairly quickly, because it's your ability to treat it isn't all that great, even with excisions and stuff. If it's been there for a while, if it starts to look a little bumpy and things, then you've increased your mortality rate by 20-fold or more. But appearance helps you. Even though some age spots have a regular border to it, they don't tend to be as dark. They tend to be kind of a light tan. Also, they don't have a history of growing much over time. But if there's any question, like I say, even if it's tan and things, and the lesion tends to grow, has a little bit more of a regular border and things, a biopsy is the simplest thing to do. Just to make sure, because you don't want to be treating a spot that you think is an age spot with a laser, because you'll just mask things for a while. Eventually the cancer is going to win, and you just don't want to do that.
So if somebody at home is watching this and they have some spots and they're curious about it, what do they do first? They go to their general doctor first, or? Typically
they do.
Okay.
I have people come just on their own because they believe that what they've got is age spot. I rarely see a cancer. Occasionally, in 25 years, I've seen probably a dozen. Okay, and I've actually seen melanomas that didn't have any color.
Oh.
You'd think all melanomas are black. Well, they're not. And melanin is typically black, and that's what, if you're looking at Latin, that's what melanin means. It means black. And but some are don't have any color at all, and they look like what's called a basal cell carcinoma or just a benign lesion. But if any of them itch, or look like they're kind of growing, or if they ulcerate, it needs to come off. Okay? By the time it gets to the ulceration part, you probably waited a little bit too long.
Okay. Any skin types where you might be more prone to getting these age spots? I mean, if you have lighter skin,
people more. Fitzpatrick 1, 2, 3 tend to get it more. The darker your skin is, the less common or less it shows up. People with just real white skin, if they get an age spot, you see it.
Yeah, it's just more noticeable.
The background's lighter, and so the more, it's like some people try to get a tan to kind of cover them up, and that does a reasonable job, because age spots doesn't tend to get darker in proportion to the surrounding skin when you get a tan. But I'm not a big advocate of getting tans to cover up age spots.
So do they kind of sneak up on you? How long does it take for them to develop so that you see them, or is it just like a faint thing that just keeps coming more and more?
Typically it's faint, and it's one of those lesions that are sun related. The more accumulation of sun damage and things, the more likelihood you're going to get age spots. But they usually start off kind of like light side, and they kind of get darker because the skin over the top of them doesn't shed off quite as easy. And so it's an accumulation of dark colors in multiple layers, and so it, looking down on it, through it and things, it always looks darker than the surrounding skin. Two reasons: number one, it has more melanin in it; number two, the skin doesn't slough off as much. If you get microdermal abrasions and things along lines, or like light peels, it helps it a great deal in terms of the way it looks, but it doesn't get rid of the cells that cause it. The laser really helps get rid of the cells that cause it.
That's kind of the trick, huh?
It's a trick. I mean, you have to look at basically, any lesion that you see that's dark is kind of like if you had a computer screen or a TV screen. If you look real close, they're made up of little dark little spots and things. If all those little spots are black, and that represents your age spot, if you just, tweak the thing and turn it into a gray, if you look real close, you'll see some of them are dark, some of them are light, some of them are dark, and that's what your like I have a COT laser that I use what you're doing is punching out little holes in that dark screen so that it looks lighter. So that basically you can blend in that color better with the surrounding area.
Okay, we do have a caller on the line for you. Paul, what's your question?
Yes, Doctor, I was wondering, I've got like blisters on that, water blisters come up for several years, and one doctor said it might be a form of staph, but I don't think it's staph because I've had it before and it didn't act like that. But I'm just curious as to what your opinion is on it.
Water blisters, I mean, it looks like little tiny blisters. And where is it located?
Usually on my hands, and sometimes they come up on my neck or my face, but they're just like a water blister, like you get, from not wearing gloves.
Sure. Does it hurt?
Yes, sometimes I feel like somebody poured sulfuric acid on me.
Yeah. How long do they generally last?
Usually just a few days, and then after they clear up, and then they just come right back.
Okay. And you don't have it associated with certain chemicals that you use, huh? In other words, you can't put your finger on, well, I'm using some type of oil or something like that, or something that you use at work.
That's what I thought at first. I've been using latex gloves and trying to keep the chemicals off of me, and some things that I use, but so it doesn't come in contact with me. And then they go away and put me on some antibiotics, Bactrim and stuff like that. But it seemed like it heals. I quit taking the Bactrim, and it goes away, but then they come right back.
Yeah, and the blisters never become like little acne, like pus in it, huh?
Yeah, some of them do.
Okay, all right. I mean, there's two things that I mean, number one, the period of time that you have it seems to be on the short side. So I'd almost think it would be a contact dermatitis at some point. I mean, that's typically what gives people that. Second thing is it can be a virus. I mean, it doesn't sound like shingles because, number one, shingles usually last a lot longer. I mean, I've had shingles before, and it lasts weeks. It doesn't last days.
Yes.
So I'd still, wear those latex things and make sure that you're not getting anything on it. And to see if that helps, because if it is, the most common thing is going to be a contact dermatitis. Like I say, we have other viruses that can cause it, or of course, poison ivy can give you the same look to it, but even poison ivy lasts longer than a couple of days. I would look for a chemical. I mean, if I was a betting man, it's probably one of those. Hydrocortisone cream or Cordaid typically tends to help it heal quicker because it takes inflammation out.
Yes, sir.
Is that helpful?
Yes, sir.
Okay. But that doesn't sound like shingles, because shingles are called blister too, but it just lasts a long time and it's real painful.
Yes, sir. This is more isolated in small areas, and then I've had them come up like on the side of my ankles, maybe one underneath on the bottom of my feet, as opposed to most of the time on my fingers, top of my fingers.
Yeah.
Just little tiny water blisters.
I'd almost think it was contact dermatitis.
Okay. Thank you, Doc.
You're welcome.
Okay, Dr. Bridges here is answering all of your questions about age spots today. If you have any questions for him, give him a call, 219-4569, or you can always ask any of your questions online at ktbs.com. We'll be monitoring that as well for you. We were just, before we just spoke with Paul, we were talking about the laser procedure, and you were telling me how it's a bunch of tiny little dots that are different colors and you're kind of going in there. Is this a tedious process? Like, describe what a patient undergoes when they're going under the laser. Is it a long process, or?
It's not a long process. I mean, it takes less than a minute, okay? Because it's the same laser I use to do facial resurfacing, okay? In the facial resurfacing, basically, you're using the energy of that laser not only to lighten the skin and give it a more uniform color, but you're using it, kind of on that deeper layer so you can get the dermis or the collagen to tighten up. Okay, for age spots, you really don't need to go that deep. We do put a little numbing cream on there and things, and that's helpful because it's not that bad of a discomfort. I mean, when I do a laser, I generally will test it on the back of my hand and things. That's why I don't have any spots on the back of my hand, just to see what the energies I'm using, and I think it's appropriate. Because everybody's a little bit different. Real thin skin, you don't need to use a bunch of energy. Thicker skin, you do.
Okay.
But it's a CO2 laser, And the way it's designed is just not a single beam. It'll put the laser energy as little rows of spots, and you can adjust how close the little spots are together. If you've got kind of a dark one, then you probably use them closer together. Whereas you have a little bit lighter ones, stuff, you probably put them, it's called the pitch, a little bit farther apart, because you don't want to turn dark spot into a real light spot. And then you can feather it out to the edges too.
Okay, so you kind of put your artist cap on a little bit there and you just make it look natural. Now, are you changing the skin at all? I mean, you said it's a more youthful look, obviously, when you get rid of them, but does that little section of skin, say if you have a larger one right here on your cheek, are you going to be able to notice? Does this part of your cheek where you get it done, is that going to look even younger than the rest of it?
Yeah, because anytime you impart energy onto a dermis and stuff, it doesn't like it, okay? And part of its process of healing is put more collagen in there, and the more collagen you have, the tighter it gets. But I don't think it's going to be a significant change in it. In other words, if you had a bunch of pores there and you did it, you might see a decrease in the size of the pores, but I wouldn't say that's guaranteed.
Gotcha.
Because pores are a little bit different story.
Okay. Well, if you're a little bit younger, maybe you don't have age spots yet, you're looking to your parents and they've got them, does that mean you're more likely to have them?
Probably. It's not as genetic as one would believe and all. It's really more sun related, Sun is not your friend. It's my friend. I mean, I see a lot of people that so I don't mind it, but I try to stay out of it because I just burn too bad.
Are there any other ways to treat it? I've read some stuff about medication or freezing, and what are your thoughts on that?
Well, the medication is usually a bleaching agent like hydroquinone cream, and it's it's not like the Clorox or the things you think about when you say bleaching. What it does is that little cell whose job is to make dark granules. I mean, whether you like what it does or not is irrelevant. But that little cell, when you put that chemical on it, there's a little factory in there that goes from serotonin all the way out to a dark granule. That's how melanin is made. And when you put that chemical in there, it blocks that factory. Okay, so basically you can't make the dark granules. Now if you go in the sun, it'll knock that little chemical out, and so it'll start all over again. But the bleaching agents, basically, its job is to reduce the number of black granules that are made, and so eventually that skin becomes lighter. It never bleaches out, I mean, like white,
Right.
But that's really kind of the way that all those chemicals work, whether it's kojic acid, hydroquinone cream. Hydroquinone cream, it's kind of come under some scrutiny as far as its systemic effects. In Africa, in some places, they'll use it all over their body, and they absorb a lot of that. Okay, and it will increase, probably the chances of cancer. Small areas. I mean, there's debate. Most of it is that it's not bad and things, but there's certain groups that say any hydroquinone cream is carcinogenic. And it can cause more problems. I haven't seen that because I don't have people that use it every day for all their life. So in that region stuff, it's no problem. Kojic acid is probably the other alternative. There hasn't been a bad safety profile with it. It works the same way, except it blocks a different enzyme that hydroquinone cream blocks. They're both reversible. You stop using it, and things that more than likely this can come back, especially if you're in the sun, because that's what the those melanocytes are trying to protect you. Okay, when it makes a dark granule, it's probably your best sunscreen. I mean, because it absorbs basically UV radiation. I mean, obviously a lot of it gets passed because people get, especially lighter skinned people get cancers and all, which are caused by sun. But all in all, it's probably one of your best sunscreens. I don't advocate getting a tan.
Right.
Do it, but still, it's
right.
That's what his job is. His job is there to protect you. That's why African Americans really don't get your typical, most common skin cancers like squamous cell carcinomas or basal cell carcinomas, because their pigment, even though the number of cells that they have are the same as any other, race and things, it's just basically they'll make more dark granules per cell than let's say me. And so basically they have a protection. The risk of melanoma is probably the same as the general population, but and that's sun related too, but they typically don't get squamous cell carcinomas and basal cell carcinomas, which are definitely related to sun exposure.
Okay. Talk to me a little bit about chemical peels, dermabrasion, and stuff like that. If you go to your beauty salon and you want to do a day of pampering,
Sure.
will any of that help with age spots? Because I know a lot of them will claim that they'll help.
Yes, they help with age spots by the mere fact that age spots, the layering of the skin. Okay, if you were to take the top layer of that dead skin off, the age spot looks better.
Okay.
It looks lighter. It's going to look lighter because remember, skin, you have an area of skin, the very portion of it is the most living. In other words, it's where all the other skin comes from, in the basal cell layer. As the skin sloughs or goes, the skin cells start to die and things, they'll get to a point where you have a layer of just dead skin. So your microdermabrasions, your light peels gets rid of that area of dead skin. Over an age spot, you have more dark granules in that dead skin. Okay, and like I say, if you're looking straight down on an age spot, you're looking at layers and layers of dead skin, and then you have healthy skin underneath it. All of them have too many dark granules in it, so it looks darker. So your microdermabrasions, very helpful in getting, when we do age spot treatments and even do lasers, we'll have them come back and do some microdermabrasions to get the dead skin off also. That just speeds the process up. Chemical peels do the same thing. They really remove that top layer of dead skin, makes skin look fresher. It might look a little tighter for a while just because it's a little bit of an irritant, okay, and it has a little bit more, moisture in the skin just because you just injured it. But I think they're very, very good for that.
Okay, so of everything out there that you can do, what do you find to be most effective and why?
I think basically using the lasers to get rid of them, okay, because if you get rid of the cell itself, which your chemical peels don't, your microdermabrasion does not. The melanocytes that make dark granules live in the living portion of the cell. That's the deepest portion of the skin, and so as they go about their business, they're always going to make dark granules. If you use the laser to kind of punch those out, okay, then the area is going to get lighter. I mean, it just has to. The other melanocytes that are around there, you really want to keep them kind of tamped down during a certain period of time before and after, because when they get mad, they'll make even more dark granules. So, so there's a process that you're going to do to take care of the age spots.
Any patients come in and say, well, I've tried this home remedy or that home remedy and it was supposed to help, and it just has no basis, and it doesn't work? Yeah,
I mean, grandmother has, remedies for everything, it seems like. But no, they typically don't work, because if they did, they wouldn't come see me. There can be some bizarre ones, like even using Clorox on those areas, which again, it's just going to damage the skin more, and I don't know if it's going to take care of the melanocytes.
Okay. Well, what if you have other markings on your body? What do you do then?
Well, typically the other markings are either a raised lesion, like a basal carcinoma, okay, or let's say actinic keratosis, seborrheic keratosis. Those are those little button things you just see usually up in here. So you can see them on the back in older people. Okay, they're kind of dark and things, and if you scratch on them enough, they'll actually come off. But and then there are also vascular lesions, like around the nose. You get the little red spots. People with rosacea get the red cheeks. So, and there's ways to take care of those too. I mean, typically with the rosacea, using little YAG lasers or alexandrite in some people helps a great deal with those, because you're knocking out the number of blood vessels that are causing that color. Because all the color you see in rosacea, which is redness in the cheeks, from chronic inflammation, which we don't know exactly why that is there. Some people will respond to certain antibiotic creams, the other ones won't. But that chronic inflammation induces the more capillaries. Okay, the more capillaries you have closer to your skin, the pinker it's going to look. And it tends to become on the irregular side too. You use laser for that. Sometimes intense pulse light works well on those. If it's a little bit on that lighter side, you don't need the strength. We have that at the office also, but they're all treatable. You have to do little test doses, okay, to make sure that basically the energy is right, because Lord knows everybody's skin's a little bit different, and one color if you have two different people and the color of the area is the same, you still need to test those because one might have more of a reaction to it. I mean, you can end up kind of burning people, with those, with any laser. Okay.
So what does that test like? What do you do?
They come in, we put a little numbing cream on there, wait for about 30 minutes and stuff. Then I usually do two. Okay, I'll pick out two different settings and stuff, and then zap it. And when you're going real superficial, we do have a little chiller that's on it, okay? Because you really want to preserve that top layer of skin. You don't want it blistering. I mean, you can still go through all that trouble and still have that, but those are precautions that you take. And see which one basically gives me something that turns from a red to a little bit darker color. The darker color means I've kind of coagulated those vessels, and that's really what you want to do, okay, without blistering the skin. If you blister skin, it's going to heal, but it certainly is a nuisance having a little blister on your skin, for a couple of days or so.
Yeah.
But and then you have them back and see how well it did. I usually have them back in about 3 weeks or so. If it's lighter and one test dose is better than the other, then I'll go with the one that's better.
Oh, so it takes a few weeks to see the full results?
Absolutely. Yeah.
Okay.
Remember, it's just, anytime you use a laser, whether you're trying to get rid of red spots or dark spots, it's a calculated trauma. Okay, in areas that are red, in other words, have more vascularity to it, it gets a little inflamed. I mean, you can have some swelling in those areas versus a flat spot like an H spot.
Okay, we have an online question for you from Susan. Susan says, hello doctor, will exfoliating with drugstore exfoliators, will that help with age spots? I've been using one for quite some time, haven't seen very much change.
Yeah, it all depends upon where the majority of the spots are. I mean, the melanin, like I said, it's a layered procedure, okay? It's for your skin is about, let's say it's this thick, okay? The half of it, and below are live cells or cells that are still alive but dying off, okay? The very top layer is all dead cells, okay? And in that bottom layer is where you have the melanocytes, whose job is to make dark granules. And as they make dark granules, the dark granules get spit into other cells and between other cells, and those just go up. Your over-the-counter exfoliants and things only take care of those dead cells, or at least improve them. I mean, with the over-the-counter stuff, it's not strong enough but they don't want to injure anything. The liability would be too high. And not like I want to injure anything, but I can use a little bit stronger acid than basically they can ever use.
Because you're the professional and you know what to do.
Yeah, how it's going
the
to
average
respond.
person at home doesn't know.
Right. I mean, we know the skin types. Skin types just respond with this. I mean, there's a series of steps that you're going to take, in order to get that. But the external exfoliants will take care of that top layer. And so, they're probably a little lighter than they were before, but you might not be able to tell. That's why, if the melanocytes, if you use a laser and you just you're punching out little melanocytes, I mean, there's some that you want to stay there because you don't want to turn a dark spot into a real light spot.
Okay. Well, real quickly, we have got 2 minutes left, and we've got Lakeisha on the phone. Lakeisha, what's your question?
I just wanted to know, what could you use to treat skin tags?
Skin tags.
Okay. Where are they?
On my neck and like the upper part of my face, like around the eye.
Yeah, typically, I mean, they're benign lesions, okay? And typically, you put a little numbing medicine on top and you actually snip them off and you put a Band-Aid on. That's the best way to take care of them. They don't bleed very much and things. I mean, they're a real nuisance, and they can get inflamed. And they can get kind of bigger and things when they're inflamed, and especially around the neck. Sometimes in the armpit regions. That seems to be the most common place besides around the eyes.
Yeah, I've got them there as well.
Yeah.
Okay, well, thank you very much.
All righty.
Okay, thank you for your call, Lakeisha.
Okay, bye-bye.
Okay, so in this last minute here, Doctor, what would be your final advice for people out there who are dealing with some of these issues? I mean, a lot of people are.
Right. I think, since 20% of people will get, some results with the over-the-counter lightening agents, then you can use those first. If you've used those and they haven't been helpful and things, then basically using, an ablative means, in other words, using a laser to kind of knock down the number of cells that are causing the dark areas is probably the most reasonable thing to do. I do kind of treat them about 6 weeks before with some type of blocking agent, because those cells that we leave behind will get mad about what I did, okay? And their job is to make dark granules when they're mad. They get mad when you get in the sun. That's why you get a tan. Their job is to make dark granules.
Okay, and if people have more questions, is there a website or phone number they can reach you
Yeah,
at?
the phone number is 318-219-8555. The website is bridgestobeauty.com.
Okay, a lot of great advice today. Thank you so
Thank you so much. I enjoyed
a lot
it.
to think about, and I hope that helps everybody out there. And that'll do it for us for this edition of Healthline 3. We hope to see you next time. Have a great day, everybody.